Hello everyone, welcome to Lockdown Seasonal. Today we talk about America's medical and insurance information. America is the most powerful country in the world, and 28% of its annual GDP is spent on medical and health insurance, about 3 trillion US dollars, which is 4 times of their budget for defense and 3 times for education. Yet, even with this formidable investment, America is still the only one country that without universal health care in the West, and its medical system is regarded as the worst among the developed countries due to its high price and lower efficiency. It invests of dozens of billions of dollars in the pharmacy and facilities annually, yet its medicine costs much more higher than those of other countries. There are numerous hospitals and clinics around America, yet it always takes several months for a doctor appointment. The annual income of US medical and insurance business is about $5 trillion, the ninth largest economy in the world if it is regarded as an industry or a country's GDP. America's medical companies spend about $400 million every year for the lobbyists to Congress and other government agencies for keeping their own huge profits. Therefore, it is no wonder that everyone can see something wrong about America's medical system, yet it is hard to change or reform. It's an issue about moving the cheese of some interest groups. First, about America's hospitals. In America, some hospitals are operated by government, some others are private. The government-owned hospitals are mainly for military services and for active soldiers, their families, and veterans, some only for the native Indians. So most of our Americans have nothing to do with these hospitals. Most of our American hospitals are private, and some of them belong to the religious and organizations and charity groups, mainly for non-profit with lower price. Yet the private hospitals are mostly for profit. Many of the big hospitals are for specialty treatment, and appointment is needed, except the emergency department. In America, it is not the case to see doctor anytime you want. Usually, you contact your family physician first, and or go to emergency. Depends on. That's even at the emergency room, you will have to wait, and it costs you more. American hospitals usually have better facilities and surroundings, and the security checking is always needed before entrance. Some hospitals only permit the appointed patient getting in, or at most with one more family member. Because of fewer patients in a hospital, so it is quieter and relaxing, and similar staying like in a hotel. Appointment is mandatory, so a doctor only takes care of few or most a dozen patients for a day. Much fewer than those doctors in China who deals with dozens of patients or even more than 100 for a day. The one thing is particular that there is no line for paying fees in US hospitals. For in America, the seeing doctor and treatment is first, payment is later. Usually the bills will be mailed to your home. Health insurance covers most of the charges. The patient pays the deductible and some extra. Sometimes you might receive medical bills with astronomical figures. It's a dozen or even hundreds of $1,000. Yet it is another story that whether you can afford for it or you pay or not. Doctors and the relations with the hospitals. It takes long for being trained as a doctor in America. First, you should graduate from a college and then enroll in medical school until you finish the doctorate degree, the intern in a hospital, and many years of practice. The tuition for medical school are very expensive. about $300,000 by average. As medical training is rather competitive, and about 8 to 10% of the enrolled students will fail and have to quit. For protection of American students, usually no foreign students are lured for American medical school or even the nursing school. Foreign doctors cannot practice in America until license obtained. America is short of doctors right now, and there are about 800,000 doctors in America nationwide, and 600,000 of them serve in communities as family physicians. Basically, they are all general practitioners coping with all common syndromes, annual physical exams, vaccination, and recommendation. Whenever needed, a family physician can provide a referral to the specialist doctor or specialty hospital based on his or her diagnosis. Most of the American doctors practice independently with a higher income, yet also with a higher risk of liability. More and more of them considering the model of cooperation in current U.S. Medical reform, working together with a hospital or joining in, yet with lower income. In America, there is almost no issue of discord among doctors and patients. There's no scenario for red envelope of a bonus payment to the doctor from the patient, which is totally prohibited. And if that happened and made public, the doctor will lose his or her job permanently, which does not pay. Medicine and fertility. In America, seeing doctor and taking medicine are totally separate. Doctors works for diagnosis, treatment, and prescription, nothing to do with sales of medicine. Only the patient himself or herself picks up to the drugstore designated, such as Walgreens, CVS, Walmart, Costco, and Sam's. Very convenient. Sometimes brand name drugs are in the prescription, which is excluded from the insurance. Mostly are generic drugs with a good price and work well, covered by the insurance. If refill is needed, doctors may give you another prescription. In the drugstore, some medicine need prescription and some not. Some specific, like Viagra, cannot be purchased at the store without doctor's prescription. Yet for the non-prescription drugs, such as for catching cold, cough, fever, allergy, and nutrition, you can buy freely. American government and pharmaceutical companies have invested tremendously in new medicines and facilities. Their leading positions and hegemony have resulted with much higher drug price in America than in Europe and Canada. In physical exam and other pathology studies, sometimes with overdue treatment or abuse of facility, such as our use of scanning or NMR, that kind of waste of medical resources and increase of medical cost. Then medical insurance in America. There are federal insurance and commercial insurance in America. It's a federal insurance means the Medicare and Medicaid that approved since 1965. Medicare is the federal insurance for all Americans about 65 years old, mostly ready for retirement. The Medicare is also called as a red and a blue card with full coverage of hospitalization, but not for all seeing doctor and medicine. So additional commercial insurance is sometimes needed. Normally, the cost for the Medicare has been withdrawn from your payrolls when you work. And your income withdrawal usually for federal taxation, Social Security, and Medicare. Another is Medicaid, nicknamed as a white card, closely related with your income. That's a kind of bonus to the people in poverty. With family income less than $27,000, individual income is less than $15,000, and no deposit in the bank. That depends on in different states. People qualified for Medicaid does not have to pay anything in medical. America passed Obamacare in 2010, which greatly relieved the situation of uninsured in America and reduced the federal subsidies in medical. For those of unemployment, commercial insurance is available on marketplace. You can buy by paying just $10 to $30 for your premium, or even nothing to pay. Depends on your income and choice. You'll enjoy the same benefits of insurance like others. Most of the commercial insurance in America is provided by companies for their full-time employees with premiums share half and half, which started in the year of 1954. Commercial insurance has more categories, with basic ones charges very little, and the better ones charge more. The employees can put their spouse and the children under 26 to the insurance with paying extra. Besides, a visit to the dentist or ophthalmologist may not be included in the basic insurance. You can buy extra. It is estimated that currently there are about 900 insurance companies in America, with 10 largest ones among them, and 90% of U.S. medical insurance market is covered by the first 100 companies. Generally speaking, America enjoys abundant the medical resources and higher quality medical services. The only issue is the system and mismanagement. This public benefit of life and treatment has turned to be specific. That means of a huge profit for some groups. That's a burden to the society and to their families, which is also common in some other countries in the world. And here comes the end of today's program. And thank you for your watching, and see you next time. Thank you. Bye.